For centuries, history and geography have united Syria with Lebanon. They are neighboring countries who share a border that is 330 kilometers in distance. Lebanon is located in the southeast of Syria, forming almost all of Lebanon's borders from the north, east, and southeast. This is all in addition to the familial and social ties that occur through intermarriage, linking the two countries together further. Damascus and Homs, which have been trapped since the start of the crisis, were only given access through Lebanon. Syrians of southeastern cities and countrysides such as Hama, Homs, and Qusayr fled to Lebanon, forming nearly 25% of the population of this small country. This percentage is concentrated in Bilqa'a Valley in the east of Lebanon and in Akkad and Tripoli in the north of Lebanon. Refugees are living in homes that lack services such as supplies, electricity, plumbing, and ventilation. Hundreds of them rely on tents to set up on private territories, which has formed private camps since the Lebanese government has not yet agreed to the establishment of camps that accommodate such a large number of refugees, unlike the typical international standards. Not to forget the wounded and injured fleeing to the Lebanese hospitals for treatment during these times. Refugees are in need for constant medical care, especially those who suffer from chronic diseases. Consequently, the Relief Associations Union for Syrian Refugees Care in Lebanon has been looking after this tragic situation, headed by Al-Sheikh Ahmed Al-Amari as a General Secretariat member in the Union of Muslim Scholars, and by Al-Sheikh Hussam Al-Ghali as the General Coordinator, and with the participation and joining of hundreds of Lebanese associations, specifically those that work for the relief of Syrian refugees. The union aims for coordination of relief work among all collaborating organizations in order to have an efficient work environment in helping the Syrian refugees, enabling them to live with dignity while being in Lebanon, and to support them with basic needs for living and health, as well as secure them with psychological, intellectual, and educational readiness to rebuild Syria with their own hands so that they can return to their country. Our organization, based on the research studies and statistics we collect, creates departments and projects that are essential to the needs of refugees. These departments are projects, reports, medical, media, da'wah, and psychological support. The Relief Union has established 5 essential categories under which many projects fall to serve our targets. The first one is relief. The Syrian refugees, typically from the first moment of their arrival in Lebanon, need emergency relief assistance. Also, an asylum duration increases, the need for follow-up assistance increases as well, especially for families who lack a breadwinner, and families who lack breadwinners cannot find a job. These problems are tackled with key projects, which are daily needs, housing, sheltering, and seasonal projects, especially that are special for the summer and winter, under which multiple projects arise every day to each of these relief categories. The second category is educational. Children are the most affected by the refugee status, both physically and psychologically. For this, the education activities were formed, which includes educational and psychological support, and the psychological project is aimed to mitigate the adverse mental effects of war on Syrian refugee children through the recreational and social activities. The third one is medical. The medical portion is the largest part in the map of projects because of its urgency and necessity, continuity, follow-up, and high-cost demands. The medical portion is divided into 3 main funds. The first fund is the Medical Center Funds support medical needs and private transportation of the wounded, as well as their transportation from the Lebanese-Syrian borders to hospitals and medical care centers. The medical center is specialized in rehabilitation and follow-up and insurance requirements. The second is the Wounded Fund, which specializes in securing surgical and prosthetic insurance for patients as well as artificial limbs. And finally, the Patients Fund, which supports patients who are in a post-surgery circumstance, fatal condition, and suffering from a chronic disease. It also funds medical reviews and drug administration, as well as draft analysis and radiation project. The fourth category is internal project. Union of Relief Associations, as well as many international associations, are concerned with the help of the displaced Syrians inside Syria, especially in besieged areas and cities that are located in the midst of war and destruction. For these reasons, we initiated the internal project, which involves activities such as Syrian-oriented project, medicine, food, and other hospitalization. The fifth category is social projects. Many issues that arose from the war are causing long-term damage for Syrians as well as Syrian society. This is why our organization has a project focused on social development. This part combines advocacy and development assignments, which tackle and prevent the adverse long-term impacts of war from continuing, especially after the crisis has ended. It is directed to the educated class, religious preachers, youth, and intellectuals to strengthen their role in the successfully building a new Syria. One of the achievements of the Relief Union after we became officially recognized by the Lebanese state is the introduction of a customized and specialized software that is made to calculate and compare collected data on Syrian refugees from different areas so that a number of Syrians in all places of Lebanon is known and differentiated. This helps us to study, research, and conclude statistics of the population, specific needs and injuries of the Syrian refugees. The Union organized the first conference for the study of the situation of Syrian refugees in Lebanon under the auspices of the Islamic Cooperation Organization and the Islamic International Organization for Charity. We have also issued a memorandum submitted to the Donors Conference in Kuwait and several international bodies. The Union was also able to represent Lebanon in a number of international conferences, including the Donors Conference for NGOs in Kuwait and the Organization of Islamic Cooperation Conference in Turkey, and the Education and Science Conference in Cairo. Other successes we have achieved have been the establishment of a higher council for the coordination between the Union and other major Lebanese organizations whose laws initially did not allow them to join the Union, such as the Red Cross and others. Unifying medical funds to adjust medical benefits for refugees established by the Union through singing agreements with hospitals throughout the Lebanese territory. We have helped in arranging the educational process and system. The Union has cooperated with the Iman schools and certain other schools to create a Syrian educational program for Syrian children throughout Lebanese territory. The schools have accompanied more than 17,000 students and provided them with Syrian literature and learning techniques to create a more nostalgic Syrian environment for the students. The establishment of clinics and medical centers for Syrian refugees that work 24/7 in Saydun, Beirut, Bekaa, and North and Mount Lebanon. There was no solution for the scarcity of houses, but through creating temporary camps and providing caravans, tents, and other means of shelter, we have helped people find a suitable living environment. Our union is a pioneer in its creation in the social development enterprise in Ka'a, Arsal, Aqar, and Ta'alabaya. Currently, our groups are looking for lands to set up mobile homes and always giving psychological support to those who need it. Finally, our union, while continuing its efforts, projects, and achievements, cannot help but thank all donors from all Arab countries and the rest of the world and notice the good found in people that stand hand in hand with the tragedy suffering of the Syrian people who are living in such harsh conditions and who help and hope for a better and healed Syria. We also appreciate the efforts of the working team who is currently working on the success of union projects.